So what are we saying? So for moisturizer, in the summer, you want them to be using a lighter moisturizer. They can use something. So there's one example, like there's this brand called Vichy. They have a kind of a moisturizer called Mineral 89. It's just like very light moisturizer, but it contains hyaluronic acid. So if someone is like looking for like the lightest moisturizer, that's something that I would recommend. That's over the counter. Okay. It's good for like oily skin types, so their pores don't get clogged. And yeah, so just in general, summertime, we want light moisturizers. We want things that are glycerin based, ceramide based, hyaluronic acid based, nothing thick, because it's not necessary. And then for the sunscreen, we always prefer mineral based sunscreens over chemical sunscreens. Now, because we treat darker skin types, the tendency is to go for chemical because because of the white cast, right? And so obviously use the sunscreen that you'll be consistent with. So some people like Black Girl Sunscreen, Supergoop. Those are chemical based sunscreens, but I like to push people towards more physical sunscreens. So I'll push them towards Korean based sunscreens.
Mineral is physical?
Yeah, mineral and physical are the same. Okay. They're synonymous. Okay. So I'll push them towards like I like La Roche-Posay has good mineral sunscreens. Elta MD has good ones. Color Science is like one of the top people for sunscreen. Honestly, that's like their forte. So just encourage mineral sunscreens that don't leave a white cast, because then they won't use it, right? And then the next option is going to be Korean sunscreens, because the filters are pretty good. I know the US is trying to ban them, but hopefully they can still find it some way, somehow. Yeah. And then the last option is going to be the chemical sunscreens. So yeah. Okay. Especially for people who have sensitive skin, they tend to not do all chemical sunscreens.
Black Girl Sunscreen, and what's the popular chemical one?
So popular chemical one is Black Girl Sunscreen, Supergoop, or it has a dupe from Trader Joe's.
Yeah, Trader Joe's dupe.
And then I'm trying to think, anything that has like avobenzene or any of those. Benzene, yeah. And then, so those are like the core things that you need to be really familiar with. You need to be familiar with cleansers, moisturizers, and sunscreens. And then even within the cleanser category, then now you have to worry about age groups, right? So the teenagers are going to be oilier and they're dealing with acne, so you're trying to get them to add a salicylic acid versus benzoyl peroxide cleanser, versus people who are more middle age, where they're struggling with mature skin, so they need exfoliating cleansers like glycolic acid, right? So like just within the foundation, there's so much that you need to learn. So if we go back to cleansers, for younger patients who are acne prone, you want them to have a salicylic acid in addition to maybe a foaming cleanser, right? And the salicylic acid, they're doing that twice a week, for example.
Twice a week.
And then ask them to use it like a mask. So when they put it on their face, they leave it for like 5 minutes before they wash it off, so it can go into the pores and, clean out the oil and the debris. The other option is going to be benzoyl peroxide. 4% is going to be on the face, 10% is for the body. So a lot of people come in with back acne, so that's going to be a good option for them.
And you would recommend just like the
Panoxyl. Yeah, I like Panoxyl. Same thing, they have to leave it on for like at least 5 minutes for it to go in. The warning you have to give them with Panoxyl is that it will bleach their clothing, so if they use it, they need to use a white towel or wear a white top afterwards. And this one is really good too for athletic girls or very sweaty girls. So again, benzoyl peroxide is very good for killing bacteria, which is part of the acne component, right? So acne is bacteria, you have inflammation and oil production, those three things. So that's like cleansers. And then for older women or men, well, stick with older women because that's what we see.
Mm-hmm.
I like to tell them to use glycolic acid cleansers, so oil of Olay or any of those over-the-counter options. They have glycolic acid cleansers. Usually it's like 3.5%. So that's good for their mature skin. Or just have them use glycolic acid as a toner, because as they get older, their estrogen levels drop, so they're gonna have a harder time shedding the skin, the dead skin. So they need help. So that's where chemical exfoliants come in: glycolic acid, lactic acid, and that's pretty much it. If they're dealing with hormonal acne, again, we put them back to the salicylic acid. That's going to be helpful for them, but it's more of a nutritional issue, so that's a whole nother ballgame. And then if we're talking about moisturizers, again, for the younger patients, they need more lighter moisturizers because they tend to be more prone to acne. So you don't want something that's too heavy that will cause more breakouts for them. And then as they get older, they need more and more moisture because they're losing it because of their estrogen dropping. Right. So as you get older, they need to just moisturizer is like everything for them. The thicker, the better, and typically better at night. Okay. And then for sunscreen, it's the same for everybody. So like that's like your foundation for like skincare. Okay. And even then there's still stuff that you can break down, but just work on like looking into that, going into the stores and like Target, CVS, Walgreens, and asking yourself, what are the patients already using, so you can kind of veer them away from the bad stuff, like scrubs. We just don't want scrubs on your face, all those beaded scrubs. If they want something, they should use a chemical exfoliant like one of these acids, right? So go into the stores, see what's in the stores, and then kind of get an understanding for the skincare, so you can give them better advice when they come in. If they want to use something over the counter, you can give them like, okay, this is what you should avoid, this is what you can use, and obviously just stick to the foundations. Okay. Does that help?
Yeah, that's really, really helpful. What about people who like to do like an oil cleanse first and then like a moisturizing cleanse?
So oil cleanse. Yeah, that's fine. So like cleansing is so tricky. If you use makeup, then your first option should be an oil-based cleanser, because oil will help to break up the makeup, right? So that's like a good place to start. And then some people like toners. I'm not the biggest fan of toners, but like a lot of my estheticians in the past are very big on toners, so I don't mind it per se, but I think I try to limit the steps as much as possible. So I feel like if you have a good cleanser, then you don't need the toner step, right?
Yeah, the toner just sort of like, it's marketed just to reestablish your skin pH after you stripped it.
Yeah, but then if you have a good cleanser, then you don't necessarily need to strip it, right? That's why I love our salicylic acid cleanser, because even though it's 4% salicylic acid, it does not strip your skin. You still feel moisturized, where if you add now vitamin C or a moisturizer, there's no need for an added toner. So but if someone is a makeup wearer, I would make them triple cleanse. They never clean. Those makeup, it sticks to the skin. Like I'll be doing a procedure and like they're like, oh, I washed my face and I'm still cleaning out the makeup. It's very and so a lot of people who wear makeup are going to be prone to acne. So I would tell them to triple cleanse. Have an oil cleanser, maybe use like a micellar water or something like that. And then use the regular foaming cleanser, and then another added step, like really. So now that might be a good place where a toner makes sense, because now I'm asking them to really over cleanse their skin, because I need the skin to be clean so they don't get bacteria into the pores. So if someone's over cleansing that, then a toner might make more sense.
Okay.
Yeah.
Okay. Okay. So good stuff. I think that the sunscreen should really be
So now you're gonna have to like learn about sunscreens. Yeah. That's a huge thing, especially because culturally or within our culture, or yeah, we just don't do sunscreen. I never grew up. I only started using sunscreen when I got into skincare.
Yeah,
I didn't know about it. So one of the biggest things that I talk about on social is the fact that being in the northern hemisphere, wearing sunscreen is very important for two reasons. One, the UVA rays is higher, or the index is higher in the northern hemisphere. So UVA promotes photoaging. So the likelihood of you having hyperpigmentation or sunspots is higher. So definitely need to wear sunscreen. And then the other thing is we tend to have more inflammation in our skin because we eat more processed foods up here. So then that's where acne comes in, amongst other things. And then you add the sun on top of that, then we have more hyperpigmentation. So sunscreen is very, very important. Like, that's all I have on my face right now. Like, because I did my skincare routine last night and I woke up and I was like, I don't need to put anything on, but I need my sunscreen. Put that on my face to prevent hyperpigmentation and further aging of the skin.
Okay. Most people say, oh, it's not sunny outside.
So they still need to wear sunscreen because the rays that come through the window is the same UVA rays, right? And there are some studies that say that screens produce blue light, and blue light can also cause screens do produce blue light, but there are studies that say that it can also cause photoaging. And so if you are on your computer all the time and the blue light's on your face, then that can cause that, right? There's a reason why ophthalmologists or eye-related doctors want you to wear blue light glasses, because that's causing damage to your eyes. Then obviously it will also cause damage to your skin.
Right. Okay. Let me see. So should we, like, I know there's a bunch of different, we touched on skincare a couple days ago, and we talked about the different acids, like kojic acid, azelaic acid, glycolic, salicylic.
So those are acids specifically to help with pigment. There are other acids that you need to worry about. So on the next time we talk, we'll talk about acids, just acids, and then I'll tell you where the acids go.
Okay.
Like so like there's like alpha hydroxy acids, there's beta hydroxy, and then there's another one, PHAs. I don't remember the name of it, like that part. And those acids are more exfoliating acids. So those acids at high concentrations are what we use for chemical peels.
Right.
Right. And yes, it helps with pigment too, but those are separate from like pigment acids. So chemical peels are going to combine a couple of those. Some of them are exfoliating and some of them are pigment focused. But that'll be a lecture for another day.